after COVID-19, addressing the mental health, substance abuse, and overdose crisis in Florida. We're going to be starting in just a few seconds, just waiting for a few final folks to join on. And again, I'm Andre Bailey. I'm CEO of Project Opioid. Looking forward to having a great discussion today about an important topic, one that's impacting all of us right now. And so we'll go ahead and begin. So again, next slide, please. After COVID-19, addressing the mental health, substance abuse, and overdose crisis, we're going to have an important discussion today about where our family of communities, our state is right now on this important topic. Next slide, please. Again, that's me. This is back when I used to wear a tie. Remember 2019? Any of you have photos like this where you used to wear ties? So again, I'm the founder of Project Opioid. Anytime during this webinar you have questions, feel free to email me, text me. Next slide, please. We have some great guest speakers. We're going to get to them quickly. Senator Rick Scott, U.S. Senator of Florida, you know him. Pat Garrity, who is president and CEO of GuideWell and Florida Blue. Tim Cook, president at AdventHealth. Altamont, Sheriff Dennis Lima, you know Dennis Lima, Seminole County Sheriff Extraordinaire, and Kim Lopdrop, CEO of Red Lobster. These are our speakers. Next slide, please, Kendall. And so what is Project Opioid? For many of you who are joining right now, we've got lots of people joining all over the state. What is Project Opioid? Project Opioid is about leaders taking action. It is over 100 Central Florida companies, businesses, the faith community, philanthropy, coming together to work on this incredible mental health, substance abuse, and overdose crisis. Next slide, please. Project Opioid is also about these three things: building coalitions of the business community, faith community, those in philanthropy, bringing them together for this incredible crisis that we're all working on. It's about advocacy. We've got to get the word out and reach people who are in need. And it's also about community engagement. Project Opioid is about this idea that when you bring leaders together, we have to look at taking a pathway with these leaders towards using data, putting together strategies, and making sure that we have the ability to not just talk about these important issues, but make big things happen. So that's Project Opioid. Next slide, please. So you guys know, before we move forward, if you have questions, you can go into the Zoom chat box. Amazing technology here, but you can go into the Zoom chat box or private message us directly at admin@projectopioid.org. In the Zoom chat box, you can put questions. If you have comments, go ahead and put that in there as well. Team, we good with everything else? Okay. So before we bring Pat Garrity on, Pat's going to come on in just a second. But before we do that, I want to give you guys, I encourage you to screenshot this because there's 3 big webinar takeaways. And this is the first one. Webinar takeaway number 1. At home, scream out to whoever's at your house or the cat or the dog. Say, webinar takeaway number 1. That is, COVID-19 has created the greatest mental health, substance abuse, and overdose crisis in Florida and U.S. history. I've got big data. I'm going to share with you new cutting-edge data in just a few minutes after Pat Garrity and after Senator Scott present. But this is the big idea, one of the big ideas today. We've never seen the data coming in on the mental health, substance abuse, and overdose crisis, even in 2019, as bad as it was. So we've got to bring leaders together to do something about this. Next slide, please. Go back one real quick. As you guys have seen, overdoses skyrocketing in 2020. We believe that you're seeing all of what we've all felt this year: isolation, loneliness, fear, anxiety, PTSD, economic uncertainty. That is what we're seeing impacting people's lives. And so we are now working together on this important issue. Next slide. Let me bring in our first presenter. Pat Garrity is the president and CEO of GuideWell and Florida Blue. GuideWell, I want to make sure I get this right, over 27 million people in 35 states that are underneath their umbrella, including 5 million in Florida. Pat and his team at Florida Blue and the Florida Blue Foundation also helped get Project Opioid started in 2018. Muhammad Ali used to say, it's not bragging if it's true. There would be no Project Opioid without Pat Garrity, Tony Jenkins, and the whole team at Florida Blue and the Florida Blue Foundation. So let's see if technology works for us. Let's go ahead and bring Pat Garrity on. Pat, how are you doing?
I am doing well, Andre. Thank you. And thank you for the introduction. Let me
That's
just say,
our first speaker, so of course, yeah, if technology is not going to work,
Andre, can you
Pat,
hear me?
can you hear us okay?
Yeah, I can hear you loud and clear. Am I not coming through?
I can hear you, Pat.
You can hear me.
Yes.
I can hear you. Yeah, we all can.
We can hear you.
Okay. So it's just Andre's problem. Let me continue. Catch up with you in a minute, Andre.
We can't hear me.
Let me just say, at Florida Blue, we've been really aggressive about taking on the opioid epidemic.
We can't hear you, but go ahead and keep talking. We'll fix it.
Everybody else can.
Okay.
Yeah.
In January 2019, we were part of launching this, as Andre said, the Project Opioid for Central Florida, and that was an important first step. And since then, we've had all the different leaders who are involved today and others that have been on the project, from philanthropy through business through public leaders, and we appreciate everybody's effort on this. COVID-19, as Andre said, has been a very significant development, as we all know. But in response to that, I'm proud to announce today the expansion of Project Opioid. The Florida Blue Foundation is extending our grant that we started the Central Florida project with, and we're extending that grant to up to $1.3 million, which will allow us to expand Project Opioid to 3 other areas of the state. In North Florida, in Jacksonville, we'll be working with the Jax Chamber and Daniel Davis. In South Florida, we'll be working with 3 different organizations. In Miami-Dade, it'll be the Beacon Council of Miami with Mike Finney. In Broward, it'll be the Greater Fort Lauderdale Alliance with Bob Swindell. And in Palm Beach, it'll be the Palm Beach Development Board led by Kelly Smallridge. And then over in West Florida, it'll be in the Tampa-St. Pete Marketplace. We'll have the Tampa Bay Partnership led by Rick Homans. So we are taking what was built in Central Florida and building on the success of that effort to bring it to the vast other parts of our state. This is an effort that has to be statewide. It's such a critical issue. Our goal will be to reduce deaths from opioids by 50% over the next 36 months. And we will have more information about the project later on in the call. But now I'd like to bring on a friend of our effort, somebody who's encouraged us from every step of the way, and that's Senator Rick Scott. And Senator Scott has been just an avid supporter of Project Opioid, and he's been a leader in the effort to fight the opioid epidemic. And Senator Scott, the floor is yours. Thank you for joining.
Thank you, Pat. That was very nice. First off, Pat, I want to thank you for what you've done since you came to Florida. You've clearly made a difference statewide with your leadership. You've had a very positive impact on what's happening in healthcare in Florida. I also want to thank Tony Jenkins for what he does, Andre, and everybody else that's involved for doing this. I think all of us are impacted somehow. In my case, I've had a family member or family members that have dealt with addictions, and it doesn't just impact that person, which is devastating. It impacts the whole family. So I think all of us probably have somebody that we love, and I wish they could get a better handle on some of their addictions. But I always prayed for my family members, and it's just a hard time. I know the coronavirus pandemic made it even worse, and it's impacted a lot of people. While I was governor, we were able to do quite a few things in Florida. I just talked to a friend that just had shoulder surgery, and he didn't live in Florida. He got 30 opioid pills to deal with his pain. And of course, he was like all of us. They're scared to death of addiction, and then had no idea when he was finished with them what to do with the others that because they gave him 30 days. They would not do that in Florida. We reduced the number of days you could get in Florida. So as governor, we took advantage of federal funds to get money out to our districts. We limited the number of days you could get of drugs to try to have, all these efforts to try to have a positive impact, but it's hard. We've worked hard in the U.S. Senate to continue to fund programs that would reduce the use of opioids. And if I tell everybody, if you have ideas of things that you think I can be helpful with, the biggest thing is reach out to me or reach out to my team. Tom Power is on the phone with me. He used to work with Congressman Gus Bilirakis. He does all of our healthcare work. And so if you reach out to Tom Power, he can also be helpful. But whatever we can do, whatever I can do as a U.S. Senator, let me know how I can be helpful. This is just devastates so many families all across this country, but right here in our home state. So thank you for what you're doing. Thank you for getting started with this. I want to thank everybody for expanding around the state, for sure, what Pat and Tony and Blue Cross is doing around the state, and let me know how I can be helpful.
Senator, thank you so much. I know, Pat, you have some more insight you're going to share with us right now, because as one of America's largest insurance companies, you see every day how COVID-19, not just the virus, but you're seeing how the mental health, substance abuse, and overdose crisis is growing right in front of us. Pat, let's hear a little bit from your perspective on where we should go from here.
Well, let me tell you, Andre, thank you. We were the first health insurer to eliminate OxyContin from our formulary, knowing that it was the most addictive of the drugs. We added to what we are doing to support Project Opioid, a $3 million grant from our foundation to direct care that's being delivered to people who are in crisis. The other thing we did was we trained employees. So we have a number of employees now who know how to administer Narcan, which is a way to really balance out people who are in the midst of crisis. We know that we've touched about 7,000 people who have been in crisis through our direct work in the marketplace. And then last year, we held a session at our Innovation Center to look at all the different things that we as various stakeholders can do to address this crisis. That level of education, the ongoing dialogue, the number of different players that are involved here today really demonstrate that this is a community effort. We need people from all walks in our community to make this happen. And no one company, no one organization is going to do it on its own. The state is not going to be able to do this on its own. And so we must all work together and come together to make a difference. And so with that as a launching point, Andre, I'll hand it back to you to move the agenda along. Thank you so much for your work, and I appreciate it.
Thank you again to your entire team, the Florida Blue Foundation, Velma, Susan, the whole team there. You guys have been fantastic. And I would just tell you, as we move on with the agenda, think about this. Florida Blue, Guidewell, they continue to invest dollars in building collaboration, building business leaders, faith leaders, philanthropy, building coalitions of those types of leaders to get involved in this crisis. Why is that? I think that's an important topic for this webinar today. Next slide. Let's look at the data just a second, though. Thank you, U.S. Senator Scott. Thank you, Pat. But let's dive into the data. I encourage you guys to take some screenshots of this, but look at some of the national numbers we're seeing right now from March to today, 2020, around this overdose crisis, the mental health crisis in America. Overdoses up 15% just in the last few months. 40% of adults surveyed in the last week of June struggling in ways with mental health they haven't struggled before. I won't go through all these stats, but substance abuse up 57% since March, since the pandemic began. Go to the next slide on just the Florida stats. We didn't want to overwhelm you with statistics, but we put some of the more alarming ones up. You're going to hear more about Seminole County later. We've got Tim Cook, this AdventHealth Altamont president. He's going to talk about a program they're doing there with Sheriff Lima and other partners to directly get help to those in need. But that is a county, like most counties in Florida, we've deep dived into this, are seeing an increase in overdoses at a very high level since March. Orange County seeing overdoses skyrocket. So we're not going to overwhelm you with data, but I will tell you every data point we are looking at is overwhelming in that people are being impacted in ways they've never been before. Next slide, please. We do have a poll question because we're very fancy here at Project Opioid. We're figuring out how to work Zoom. Zoom is such a pain in the ass, but it's the only thing you can use. Sorry, I was told I'm not supposed to cuss on this. Sorry. So Zoom is a pain in the rear end, but we're figuring out how to use it. So we have a poll question for everyone on today. We have a lot of folks on. What's impacting mental health of Floridians the most in 2020? Do you think it's the quarantine and lockdown? Do you think it's political divisiveness? I don't know if you noticed, but our politics kind of divided of late. Economic uncertainty, all of the above. So go in, answer that poll question. We'll be giving you those results shortly. Next. Oh, here we go. What is impacting? Yep, they're right here. So make sure to fill this out, and we'll take it from there. We're also taking questions. So our first question, because we're starting to get questions. If you have questions, you can put them in the chat box. Go ahead and go to the next slide, please. Kendall, go ahead and go to the next slide, please. We're going to have our first question. Bill from Orlando. How do we know COVID-19 has impacted the mental health of those in our communities? A great question, Bill. Let's go ahead and pull that next slide up, please. This is really the best way. This is a challenging slide. This is heartbreaking. But we were on a call with one of our partners in Florida just last week, and talking about Project Opioid, talking about the data, talking about policy changes we're going to work on. How do we get more resources? And after I dropped off the call, I had to drop off very quickly and get on another call. But this person shared with one of our staff members that one of her own family members, this is Cody Michael Smith. Cody was 25 years old and struggled with opioids, a great kid from a great family, struggled with opioids. And during the quarantines and the lockdown, he overdosed again and lost his life. This is actually one of the photos from his memorial. I pulled this photo up and I told you Cody's story for no other reason that if you don't really take anything away from this webinar, take this away, that our young people, our family members are struggling, and many of them are dying in silence right now. And so this crisis is not about data. It's not about politicians. It's not about, all the things that sometimes we can make it about. It's about lives like Cody, that if we're not able to get more help for people, more mental health help, if we're not able to get more resources for medications that can save people's lives, if we're not able to coordinate communities, people like Cody are dying every single day, and they don't have to die. We can get them help. And so I don't want to be too heavy here, but I worry that sometimes an issue like the opioid crisis or the mental health crisis, we can become almost numb to what's really happening. This is the result. Young people, especially, you losing their lives if we're not able to come together and take action. Next slide, please. So the second big takeaway from this webinar, I encourage you to screenshot this. I encourage you to, share this. A historic amount of young people are struggling with tremendous mental health issues and beginning to lose their lives in record amounts. the amount of young individuals. It was CDC reported just a couple weeks ago. Many of you saw this. 1 in 4 individuals under the age of 25 contemplated suicide since March, right here in our country. And people are struggling in silence. So big takeaway here, make sure to know that there are so many people struggling and so many people losing their lives right now. That's a big takeaway that I want you to have. Again, if you have questions, go ahead and put them in the chat box. We're going to be answering questions throughout this webinar. And if you have an email, you want to know how you're involved in the mental health crisis, the overdose crisis in Florida, in your community, we can get you involved if you email us. Let me go ahead and bring up one of my good friends, Kim Lopdrop, who is the CEO of Red Lobster. Kim is one of the early advocates that got started in Central Florida with Tony Jenkins, Brad Rex, Sheriff Lima. I could keep naming names, but Kim was one of the first leaders who got involved with Project Opioid. We want to hear from him right now on really his perspective on the business community and why does it matter that business leaders, faith leaders, and others get involved with this. Kim, are you there?
I'm here, Andre. Can you hear me?
I can. Technology, it works.
Yes. So thank you, Andre. And first, I want to thank Pat Garrity for the generosity of Guidewell and Florida Blue for enabling us to expand this work statewide. Pat, you and your organization are absolutely incredible. We are so grateful to you for your leadership. I also want to thank Senator Scott for not only being on our program today, but also his office helped advocate for the Florida Department of Economic Opportunities application for a $5 million grant from the U.S. Department of Labor to support opioid addiction recovery through workforce development. And we were thrilled to see that grant has just been approved, which will create jobs in Florida and also help people with substance abuse disorder recover permanently and return to being contributing members of society. So really want to thank both of them for their terrific leadership. For those of you who don't know me, I'm Kim Lopdrop, CEO of Red Lobster and co-chair of Project Opioid. And I got involved in this because I have 3 friends who helped me gain an unusually deep understanding of this crisis. And they helped me understand that opioid addiction is one of the biggest crises in America, and yet probably the most solvable big crisis that America has. One of those was Brad Rex, president of eHome Counseling Group, who did a tremendous amount of research, and he helped me understand that 75% of opioid abusers started by taking a legally prescribed opioid. 80% of heroin users started with a prescription opioid. And yet somebody who takes just a day of opioid drugs has a 6% chance of becoming addicted. Somebody who takes them for 30 days has a 30% chance of becoming addicted. And once somebody's addicted, it typically takes 4 to 5 treatment attempts over 8 years to achieve remission for a single year, according to John Kelly, a researcher and professor of psychiatry at Harvard Medical School. And this results in depletion of college funds, retirement savings, many family bankruptcies, but worst of all, death of loved ones, especially now that drug dealers are lacing heroin with fentanyl and carfentanil, which are dramatically more powerful than even heroin. My second friend was Rick Van Warner, who many of you know. He had a son get addicted to opioids, and I saw his family go through absolute hell for several years. And what was so striking about this is I know Rick and his family, and they are just amazing people. And seeing what happened to them made me realize if it could happen in their family, it could happen in any family. Rick ended up writing a tremendous book called On Pills and Needles that really shared the learning they had about the whole process, about what worked, and a whole bunch of stuff that didn't work. So that really personalized the problem. And then the third friend was CEO of a health food company. This was somebody I had so much confidence in that I invested in his company. But then he died of an overdose. And this floored me because it was someone I thought I knew, and I had no clue he had a problem until I heard he was dead. So these friends helped me understand the scope and depth of the opioid crisis, that it's truly unprecedented, that it's impacting people we know and care about. It's affecting every industry. And while the economic cost to individuals and society is enormous, it's really much more of a human crisis that's affecting the lives, ruining the lives of people we care about. So when my friend Tony Jenkins, market president for Florida Blue, asked me to get involved, I immediately said yes. One of the first things we did was form an employer task force to identify and share best practices in preventing opioid addiction among our employees and helping employees who were already addicted. And fortunately, Red Lobster already had a fantastic director of benefits, Jewel Taylor, who had already been doing a lot of great work on this. And I was able to support what she was doing and frankly, learn from what she is doing. And we've been able to take steps to educate employees about opioids, eliminate the stigma of asking for help. We provide free telephonic counseling through our employee assistance program. We implemented a program by which our pharmacy benefits manager has experts review opioid prescriptions on our employee healthcare programs. And if they see something that doesn't look smart, they actually have an expert call the doctor and talk about it. And that has resulted in a dramatic reduction in use of the most highly addictive opioids and the length of prescriptions, which and the combination of those things have dramatically reduced the risk of employees becoming addicted in the first place. So we've been pleased to share our results with Project Opioid for use in their data project, and actually also been able to talk directly with several other major employers to share our results. Project Opioid has seen progress on many fronts since all this began. We now know how to dramatically reduce the risk of people becoming addicted in the first place. We now know how to effectively treat addiction with medically based treatment and counseling. We know how to save lives of people who are overdosing by administering Narcan. We still have a lot of work to do to educate people and make needed resources available, but the solutions are now clear. And we're very excited about the new grant from Florida Blue that Pat Garrity told you about earlier that's going to allow us to expand our work here in Central Florida and to other major cities in Florida. So I would encourage other business leaders and faith leaders to get involved in Project Opioid if you're not already. And whether you see it or not, opioid addiction is affecting your employees and members of your congregations. And frankly, it's clear as day that the problem has gotten much worse since the beginning of the COVID-19 crisis because of the stress it's putting everyone under, the mental illness crisis that it spawned, and the dramatic increase in drug overdoses we're seeing. So if you're not already involved in Project Opioid, I would encourage you to join us. Next, I'd like to turn it over to my co-chair, Dennis Lima, the outstanding sheriff of Seminole County and vice chair of the State Opioid Task Force. Dennis?
Thank you so much, Kim. You're very generous, and it's so wonderful to partner with you and so many great community leaders and ambassadors from our business and faith community. I also want to thank Pat Garrity. He's been on the front lines of this from the very beginning and really serves as a wonderful ambassador of everything that is good about the work that Project Opioids is doing. And then, of course, Senator Rick Scott, who, when he was Governor Rick Scott, really helped the law enforcement community really close down those pill mills that were creating a lot of this problem. I tell you, everybody who's on the call today, our collective greatest responsibility is to protect and preserve human life. And I think that that's why you were sparked to join this call, to get involved, to learn more about the work that we do here at Project Opioid. And I'm going to talk a little bit about what we have going on here in Seminole County and how we're changing the criminal justice philosophy when it comes to opioid use disorder. This is not a situation of trying to make bad people good, but rather sick people well. I think that we recognize maybe the most significant thing that we can do about drug abuse or substance abuse is to prevent it from occurring in the first place. And we're working hard to make sure that we deter people. And we've made some great progress with doctors and people in political offices and business and community leaders. But the fact remains that a lot of people were introduced to this drug because they simply followed the doctor's orders. More than 80% of the people were at one time legally prescribed an opioid by somebody that they trusted. And by the time they found out that it was not healthy for them, they had already built up that dependency. Many of those individuals, when they could no longer doctor shop, they turned to heroin or street level drugs to make sure that they could sustain. Had become dope sick, is what we refer to it to. They were not looking for the euphoria. They were looking for a way to just get through the day. So what we've done is we've created a holistic partnership here in Seminole County that has multifaceted components. One is the number one predictor of whether or not somebody will overdose and die is whether or not they've overdosed and survived. Many people who are treated would typically go into an emergency room situation. They would be stabilized. They would be either referred to another physician for follow-up. But the fact is they return back into the same environment that they overdosed in the first place, creating this unprecedented recidivism when it comes to this at-risk population. To give you an example, here in Seminole County alone, and these numbers change daily, and I'm looking at them every single morning. In Seminole County, the third most densely populated county in the state of Florida, a very affluent county, wonderful school system, great citizenship. We've had a 21 or 27% increase in overdose deaths, or to put that in volumes, 71 people in Seminole County have died since January of an opioid-related overdose. There's been a 55% in overdoses throughout the county. The number there is 521. 521 people had overdosed, 71 had died, and that would have been 521 deaths in the county if it wasn't for the availability of Naloxone and Narcan. So this is just kind of a small example of what not only we're facing, but what we're seeing trending across the country. So knowing that the number one predictor of whether or not somebody will overdose and die is whether or not they've overdosed and lived, we created, through our philosophy at Project Opioid, a SCORE team. It's a Seminole Collaborative Opioid Response Effort where we respond to every single overdose situation immediately with navigators, with people who are going to help the individual find a course and path towards recovery, but as importantly, help their family navigate that process as well. We've got a wonderful relationship with AdventHealth, and you'll hear from Tim Cook here in a moment. We take these individuals when we can to AdventHealth to start the screening process, the evaluation process, and they have navigators there that Tim will talk about here in a moment. For people who are incarcerated, and what we've tried to do is we've tried to decriminalize individuals' addictions. But for those who are incarcerated, we created an ACT program, accepting care through treatment. And we have become the only correctional facility, the only local correctional facility in the country to use all three forms of medical-based or medical-assisted treatment. We're deploying methadone, buprenorphine, and Vivitrol here in Seminole County. We feel like that should be a decision between a doctor and a patient to make sure that they're starting their regimen to be able to get out there. But we combine that with cognitive behavioral therapy, peer support with navigators. We have canines that are inside of our facility, particularly in our female housing units, to make sure that they can embrace that nurturing of taking care of the animal, helps them take care of family members when they get back out. These programs have been so successful that 3 inmates participating in the programs have asked the judges to extend their sentences because for the first time in many years, they were getting clean. They literally said to the judge, can you extend my jail term for up to 3 months because we're getting clean? And although we're proud of that serving as a reflection of the services that we offer on the inside, we realize that there's a void in some accessibility or some knowledge on the outside. And we're working to close that gap. We're working through our partners with Aspire Healthcare, AdventHealth. I mean, wonderful programs, because I think that everyone on this call understands that you can't have one without the other. These are co-occurring issues. If you're suffering substance abuse disorder, you're also suffering some mental health challenges. So when we pitched this idea to Tim Cook, he and his team, without question, said, "You know what? We think we have an answer for you." We had a building located across from our correctional facility that was a place that we ran county probation out of. And through some conversations with Tim, we thought about an idea of creating a center, a state-of-the-art medical facility that people could go to if they needed help navigating their addiction, a avenue of support for them and their family members to talk with insurance companies, to look at military veterans that may need help working with the VA, to provide some services to the underinsured and underinsured population. And he and his team came up with just such a remarkable idea. And with that, I'll turn it over to Tim, because as the CEO of AdventHealth, and I know he's got a new role here, he may mention on this call, but he and his team have been such a wonderful group to work with, and we're incredibly grateful for what they've done, but more grateful for what they will continue to do. And the last thing I'll say on this is this has sparked such an interest. We've received hundreds of thousands of dollars from the private business sector to simply support some of our efforts. So with that, my buddy Tim Cook, president of AdventHealth Altamont.
Thank you, Sheriff. And I do want to add my gratitude to the Senator and Pat Garrity and Kim and Andre and the entire team, because as we continue to learn, it is really regarding success is going to depend on how many partnerships we can leverage to make things happen. And that's what I think we've begun to find more and more. It's interesting when I think back and hear you, Sheriff, kind of the history of our discussions. You were a little bit out in front of us with the SCORE initiative, and I think we kind of began to catch up with you. But you kind of framed up Seminole County, and we're probably a microcosm of lots of different communities. But let's just call him Joe. This is somewhat of a familiar scenario. Joe will come to the ED not necessarily with an overdose, but with an infection, because he's a heroin user. And he finds there's a lot of addicted individuals that come to the ER because of medical and behavioral complications that are going on with their addiction. It would have been a year or two ago, if Joe would have come, we would have treated the infection, maybe tried to get him referred to some kind of outpatient therapy. But now we've got and I'll tell you a little more about a SUD navigator, substance use disorder navigator. They're in a couple of our hospitals. We're growing this infrastructure throughout them all, but it embraces this individual and what they're going on. And what Joe needed was some antibiotic therapy that he could not get at home. And he was reluctant to do that, as you can imagine, with the stigma and everything that goes on in someone's life, their job, their family. They did not want to go through with the withdrawal. They didn't want to leave their heroin. They were afraid of getting off this addiction. And what that meant is they needed support and help. And so the SUD navigation team rallied around him and met with him and spent some time with him, helped him really exploring the options, helped him realizing that with medical assistance therapy, he could navigate away from this addictive behavior with a supportive infrastructure of some people and some time. And once he understood the different options here, he began to move and in fact did go into a recovery after being discharged with medical assisted therapy and had a recovery. I thought the most telling thing was what he said at his discharge. He said to the SUD navigator, "Thank you for taking the time to hear me beyond my addiction." And I think this goes back to something the sheriff has really helped us understand, is moving away the stigma, but helping him beyond his addiction, longer term than just what was going on acutely with him at the time of the ER. So if you want to go to the next slide, Kendall, The sheriff and several of you have teed up the problem. I don't need to. Let's just go click through this slide to the next one. This is kind of an interesting one because it does begin to tie in a little bit, kind of ramping up what COVID has done. And this is just patients that would utilize the service of our SUD navigators. And so you can see we saw some progress in 2019, but where it backfilled was in the opioid population. More and more folks were finding these other alternatives to their addiction. If you want to go to the next slide. This is kind of interesting because, again, it talks a little bit about what we've seen with COVID. There's a lot of implications going on in our communities. Some are obvious, some are not so obvious. Some of these patients who have tried to get into therapy have been in group situations. With the COVID environment, it has either disbanded groups or moved them to a telemedicine platform. Those things, while very helpful and valid in many scenarios, aren't useful for everybody. And so we have seen a significant increase in the number of SUD patients. Now, these are not just overdoses. These are any patients that come into our EDs with any kind of addictive behavior or background. If you want to click the next one, Kendall, on a daily or a weekly basis, where we used to see 25, 30 of these patients coming into the ER a week, now we're seeing upwards of 50. So it truly has been a huge peak as we've seen the impact of all the various pressures that Andre and others talked about of COVID-19 in the mental health, the economic state, all those pressures. So if you want to click the next one. This gives you a sense of what we've looked at the continuum. We've talked about the ED. The historical ED focus was bringing in, fix their clinical condition, but we've realized that we've got to do more. So we've educated our staff much more significantly. And frankly, a lot of that was around the stigma, because for caregivers who've seen this for years and years and years, it's easy to develop a sense of dismissal a little bit for somebody who's struggling with this. So working with our teams and the care coordination, clearly aligned with the clinical side of a reversal agent, getting them back together clinically, medically stable. But then how do we keep in contact with these SUD navigators? Stay in contact with the patient for a minimum of 30 days. So it kind of matches what the sheriff's SCORE team is doing, where they follow up kind of in some of the external behavior, and our team follows up on the clinical and medical side. And it's been interesting, the relationships that form. We actually will have patients call the SUD navigators back in the middle of a crisis, say, what do I do? And they're able to de-escalate it and get them into a behavior at that moment that keeps them away from relapsing into the addiction. Inpatient, we're not here to talk a lot about that, but there's been a lot of education on the inpatient side as well, because we do have patients who need to get antibiotic drugs and things of other natures, but we're trying to move that outside. And then what I really want to focus on for a few minutes is this aspect of community partnerships. The SUD navigators do a great job, but they have got to have a strong network of community partners in which they can bring those patients into new relationships and a new infrastructure, away from some of the habits, away from some of the lifestyle, with the support that might have been lacking in their life. And so these community partnerships are critical. And we've got a couple of them I want to highlight for you here. Go to the next slide. You can keep clicking there, Kindle. There's some of these are animated. This just gives you a little more specifics of what our substance use navigators do to really try to bridge the gap. And then the critical point, though, is ensuring that they have the services out there. And that has been the biggest challenge for most medical providers, is how in the world, yes, there are providers out there, but they're for a lot of different insurance modalities. And so if somebody doesn't have insurance or the right insurance, what can be done for them? One of the partnerships we've just created with an ALF in the community is called First Step Assisted Living. This is for specific people like Joe, who needs sequential IV antibiotics that might not be able to be done at home. It gives them a residential setting. They can be treated clinically and medically, as well as getting some life skills and some psychoeducational. But this is for somebody who's really on IV antibiotics. But the thing that the sheriff talked about that was really exciting is, how could we do something yes, it's one thing, but it's one more thing, and it's one significant thing. This probation building that you see right there really was sitting empty, not a lot of use, and the sheriff said, "We've got this building. Could we do something with it?" And we brainstormed together, and you can start clicking because there's just going to be a lot of logos. The state came together with some money for us. Obviously, the sheriff's department and then Seminole County, Walmart gave a large grant to kind of get us started with some upfront cash, and McKee contractors went in with the county and began to help us renovate this building. We're getting closer. Hopefully we'll be able to open it in November. And then several other services have stepped up. And interesting, as we begin to lay out the therapy regimen for these individuals that literally in a couple months will be able to go right from the ED over into the AdventHealth Hope and Healing Center there at that county building. The services of the Sharing Center and Christian Help will help them find jobs and find therapy. I was fascinated with the grant from Blue Cross, Florida Blue, to yoga, because yoga is one of those things that helps some folks deal with the stress that they have going through. How do they change their lifestyle and their behavior, coping with the pain and the anxiety of getting away from addiction? So this facility will really have two components. One will be a level 2 residential substance use disorder program that will start with 10 beds. We'll be able to go up to 40 eventually, believe it or not, on the backside of that building, kind of a dormitory style, which allows the individual to get away from whatever behavioral home environments they have and go through this therapy. But there's a lot of folks that don't really need more than just the constant support. And so the intensive outpatient program, which will be on the front side of this building with medical assisted treatment, will be there available. So again, somebody who's struggling with what are they going to do, they don't have the right insurance. Now this facility with all those partners wrapping around that services will be available. So we hope to open that very, very soon. Well, this kind of gets us back to why we're doing this thing. You can go to the next slide. And it really does go back to people. We've used a lot of numbers, but behind all those numbers are real people. And, one of the things that somebody struggling with addiction has to deal with is, even though they may find a resource like a Hope and Healing Center, like First Steps, the ability to relapse is right there if those infrastructures are not consistently in their life. And so we have people coming into the ED with relapse. Somebody, a story from not too long ago, a lot of medical complications, going withdrawal. But the substance use navigator was able to get them. They were having problems with the program they were in. They were fighting with the counselor. So they were able to navigate them into a different program to begin to have a more positive situation. And 30 days later, the patient contacted the navigator and indicated that this therapy program was working, and they were back on the road from a relapse. So there's stories like that all over. I want to thank the sheriff again in the county, because there is no way AdventHealth would be able to do this on its own. All of those partners around, all those services that go into a fairly comprehensive matrix of services has to be done through a partnership arrangement. And I think we've just begun to break through some of that. I think as more and more of the community here in Seminole County, every community is going to have a different array of services, but the reality is they probably do have all of the services. It's just a matter of beginning to partner and connect them in such a way that the patients can get from this point of crisis into a productive course on their life. So I'm happy, Andre, to take any questions or respond to anything else. But
so Tim, I have one question for you. Thank you for that presentation, and it's a question that had come in earlier. Is a project like this, which is an incredible microcosm of what needs to happen, and programs that need to be able to grow in communities around Florida, is a project like this possible without collaboration?
No, in fact, again, one of the reasons we don't have services like this all over the country today is because, frankly, they're not economically viable for any entity to go do. And those entities that are economically viable, the only way, this is not a criticism, it's a reality, the only way they can remain viable is by a small group of people who have some kind of insurance or resources to utilize them. But for a large group of people, even if they do have insurance, it may not cover this type of service. So you're not going to be able to put that in place without the partnership of organizations like a Walmart, who are willing to put up literally capital to help this happen, independent nonprofits who are willing to create a network to support, so that there is ease. If it's not easy for someone in addiction to get from point A to point B in the service process, they're much more likely to fall out. So that network of services, collaboration wise, is critical. The churches tying into this as the faith community is critically important, because the faith community is not immune to this. There are many, many folks in many, many churches who are struggling, grappling with this. I think we all know that. That was a long answer, but the answer is yes.
It's a good answer. So, Tim, thank you so much for what you are doing in Seminole County and what AdventHealth and others are doing really beyond Seminole County. Let me skip, just for the sake of time, to our, again, we'll make Tim's contact information available. We'll give you his personal cell phone, his home address, whatever you guys need. Just kidding, Tim.
Happy to take it.
All right. But so let me just jump ahead, because we only have about 8 minutes left. Tim, I think, speaks to a bigger idea here, and that is big takeaway number 3. This is the last big takeaway, that leaders in a community, in your community, a lot of Central Florida folks here, but there's folks on this call from Jacksonville, Palm Beach County, Miami, Tampa, St. Pete. Leaders in your community can work together to transform lives. That looks like 4 things. It looks like renewed coordination. It looks like finding new data to make, Tim was talking, and some of you were thinking, gosh, that sounds kind of complicated. That's because solutions to the opioid crisis, to the mental health crisis driving it, are very complicated. Policy and legislation, and advocacy and awareness. So these are the 4 things that leaders can do. They really kind of bake together to bring a project like Tim was referring to, and AdventHealth and Seminole together. So this is what we want to see. If you say, what is Project Opioid? Project Opioid is these 4 things, encouraging leaders to get involved in them. And we're going to tell you how to do that in just a minute as we wrap up. Next slide, please. And this is also something incredibly important. I want to show you, Tim was talking, Sheriff Lima, Kim Lopdrop, talking about some kind of technical things that you maybe have never heard of, but they're important. So we're going to send you guys the slide deck. A lot of you are asking for it. But when you really boil down the opioid crisis and the mental health crisis that's driving it, it really comes down to our leaders and their community and at a state level doing these 5 things. Project Opioid has the goal of seeing opioid use and overdoses and the mental health crisis driving it. We want to see all of this impacted in a huge way in the next 3 years. But these are the 5 things that we have to do. We have to increase access to Narcan. If you have not seen Narcan, this is Narcan. If you need Narcan, email us right now, text us right now. We'll send this to you. We want everyone to understand the power of Narcan and why it's important. So that's, Sheriff Lima talked about how many lives are being saved just in his county with Narcan. So our state and our communities need to increase naloxone, Narcan, expand access to medications for opioid use disorder. If you've never studied into MAT or FDA-approved medications to impact someone who's suffering with substance abuse in general or opioids in particular, it's something we need to look into. Listen, I know you guys have heard this a lot, but we use medication to solve so many of our societal issues. Right now, we are desperate for a virus vaccine for COVID-19, right? We're hedging our bets around the idea that we're going to get a medical solution to COVID-19. We need to move away from the stigma and the stereotypes around medications for substance use, especially when it comes to opioids, where people can take drugs like buprenorphine is just one example that could change their lives and help them in an economical way have a fresh start. So expanding access to MAT. Number 3, mental health services and resources. We can try to slice this a lot of different ways, but at the end of the day, There are not enough mental health services available in the state of Florida, in this community, in communities across Florida. There's just not enough. And the services that are available are often very fragmented. That's just real. That's just the truth. But we can work, like Tim was talking about, like Sheriff Lima and others were talking about. We can work together to make more services available and break the stigma around encouraging people to reach out when they're struggling. Number 4, advocacy. And again, looking at getting information and education, especially targeted at those 40 and under in our state, in your community. If someone is going to overdose and die by taking opioids, they're probably a young person. And so we need to get education and advocacy out there. And number 5, empowering leaders. At the end of the day, you guys have worked in your community and in Florida for a very long time. You know as well as I do, if leaders, business leaders, faith leaders, philanthropy, if they're not at the table working on an issue, it's never going to advance forward. So next slide, Kendall. Here we go. Again, as some of you asked, how do I get involved in Project Opioid? Many of you are asking that right now. Remember, Project Opioid is going to be working at building a coalition, building advocacy and community engagement. Next slide, please. And Pat Garrity, next slide, please, Kendall. Pat Garrity mentioned this, but we're so excited to have new partnerships. You guys are the first to know about these partnerships with the Beacon Council in Miami-Dade, the Broward County Greater Fort Lauderdale Alliance, Palm Beach County, the Business Development Board of Palm Beach County, Tampa St. Pete, the partnership in Tampa St. Pete, Jacksonville, the Jax Chamber, and then Orlando is the Change Everything group that started this in 2018. This is going to be amazing. We're going to see this public announcement of these partnerships. This is the first time anyone's heard of it. We'll be doing a public announcement in the next few weeks. But if you are in one of those communities, please reach out to us. Next slide. We want to get you involved. Here is some contact information. This is actually my cell phone. If you text that number right now, it will come to my cell phone. So if you want to get involved with Project Opioid, I encourage you to email us, call us. We will connect you with those in need. Let me go back, take one more question because we only have a couple minutes left. If your question didn't get answered here, we will answer it after we get off. We'll answer it offline. But business community leader, question 2. Why should the business community get involved with Project Opioid? Isn't this the government's responsibility? That was one of the questions that just came in. I would just tell you this as we close. Those of you that work on this issue or other issues in your community or in Florida, you know that government, government is so important. It's got to be, it's got to be at the foundation of any issue like this working. But in my opinion, and in the opinion of many of our leaders, an issue that's as complicated as mental health, substance abuse, and the overdose crisis, government by itself will not find this solution. That is why we know, Project Opioid knows, that there are so many good folks working in every community, hospitals, or so many good hospitals, so many behavioral health leaders, substance treatment centers, others working on this issue. But without new support from business leaders and philanthropy, the faith community, what can faith communities do if they get involved? But without their support, we're not going to see the kind of impact we could see. And I'm going to close with this. I don't want to be heavy-handed here, but we need to all remember what the stakes are of this mental health and overdose crisis. The stakes are not political. They're not who gets elected. They're not, who gets credit. They're not who gets the next funding source. Those are not the stakes. The stakes are real people's lives like Cody, who are suffering with anxiety, depression. They're suffering with all kinds of substance use disorders that they haven't struggled with in their lives since COVID. And they are overdosing and dying in record numbers. I logged on to Cody's memorial. There's a link to it. I'm not going to share it with everyone. And I watched his video last night. I watched the photos that they played at his memorial. And a young man with so much potential taken from us because of this incredible mental health and overdose crisis. And what I was left with, and as we leave this webinar, is the idea that he didn't have to die, that there are things that we can do as community leaders to save so many Codys in your community, in this state, and even beyond. So I want to thank all of you. Thank you again to Pat Garrity, CEO, GuideWell, huge supporter of Project Opioid, and thank you to the Florida Blue Foundation. Thank you to all of our other participants, Tim Cook. Thank you, the U.S. Senator Scott, obviously, for his time, Kim Lopdrop, Sheriff Lima, and thank you to all of our Project Opioid leaders who number in the hundreds and are growing every day. Thank you for your passion, your leadership, and we're going to be reaching out to you very shortly with next steps. Thank you so much. God bless you for your work, and we will talk to you again soon.